in. Let us know. Well, let me just first off by saying that you guys are very close to graduating, or maybe you've already taken your NCLEX, so congratulations on being almost there. We're going to be talking today about things that we wish we would have known for our new grad onboarding. And with me today is Professor Allison, who you guys may have seen in other webinars, if you guys attended our NCLEX and nursing school webinars. And also Nurse Joe in the house. Joe, you guys both got your hair did, didn't you?
I just
Your hair looks
I
darker.
decided to wash it. It's fine.
Oh, get out of here. All right. Get your hair done. Mm. So yes, guys, today we're going to be talking about balancing yourself out, balance over burnout. It happens a lot to new grads where you just there's something called a learning curve, which we talk a lot about in our new grad prep course, which we're going to be talking about a lot today. We just came out with the new grad prep membership, which is basically packed with all these like really goodies and tips and tricks that we wish we would have had as a new grad ourselves. But I think balancing burnout is one of the toughest things because you're learning something new, and something that Professor Allison always talks about is you're not dumb, you're just new. And I mean, we can both have a testament to that. If you guys are going to the ICU, you're definitely going to hear beeping going on after your 12-hour shifts, even when you're going to bed, right?
Right.
Something like that.
And the nice thing,
But
it's you get to be new. That's okay. There,
yeah,
it's the one time that you get to be new, and you not necessarily, yes, sometimes make mistakes, but ask questions. And sometimes we're
hmm
so afraid to ask questions because we feel like that's a weakness. But again, it's expected that you'll ask questions, that you'll have that weakness. And so definitely like any tips and tricks I wish I had had about like things that I was worried was, me being annoying or abnormal, and was afraid to not seem like I was getting it so fast. And thinking like I need to be trying to feel like I know things already, or like they don't have to train me, but you get to be trained. You get to have that learning curve.
100%.
hmm
And you get that excuse to be a new grad because it is your time for learning. So if you ever had an excuse, this is your time. Not your excuse to kill someone, but like
yeah,
your excuse to like, oh, I can fumble over some type of like clinical task, or I don't know the protocol on this or that. So this is
yeah.
your time to learn.
And that's that
Oh,
that's the biggest thing. Oh, sorry, go ahead.
oh no, I was just gonna say, sorry, go ahead.
Oh no, I was gonna say, but that's the biggest thing that we wish we would have known as new grads is that you don't have to know it all. It's kind of like nursing school is kind of like driver's ed, where it's like they teach you all the things. It's not really driving. So that's why, guys, it's give yourselves a lot of grace, especially in the first 90 days, which we talk about a lot. But let's get started real quick. As I'm going through these like introduction slides, please let us know where you're from. It looks like only Javid Ali is active with us today, taking your NCLEX pretty soon in April. And if anyone's taking their NCLEX, guys, we have an NCLEX webinar that we have every month. I think we do it more frequently than that. But yes, join those because we talk about all the tips and tricks for your NCLEX as well. But
Yeah,
if you're just
definitely
joining
go.
us, yeah, Joe's there, Allison's here, we're all here. And if you're just joining us, you guys know me, Nurse Mike, and Professor Allison, who does our NCLEX webinars and nursing school webinars, as well as Nurse Joe here. And they both have their hairs done today, so it's really nice. No, I'm kidding. You guys are looking good. But let us know where you're coming from. Let us know when you graduate. And as mentioned before, we've helped you through your nursing school journey with all of our videos. We've helped you through your NCLEX with our NCLEX prep and our NCLEX mastery series or lecture series, we call it. And now it's kind of a shoe-in, right? It's like all the other NCLEX preps, they just drop you off like an orphan child and they don't even help you with your new grad or onboarding. They're just like, hey, good luck, go figure it out. So we thought that that was kind of unfair. So what we did is we put together over 30 videos in a new grad prep course that talks to you guys about everything about how to master your job, master your interview, what preceptors are looking for, where new grads mess up. And we've interviewed the top hiring managers at some of the biggest prestigious hospitals in the United States. We've interviewed the preceptors, basically your training officers, and also new grads themselves. And that's just one area. We talk everything about med surge, ICU, ER, as well as an entire skills refresher library and career guidance. And now you guys have your license to maintain. So We also offer CEUs. So if that's interesting to you guys, or if you're interested in that, Nurse Joe's going to drop a link, and we'll also have a special discount at the end of this too. Cool.
Oh,
So
and I was
guys,
gonna say, we love to see where you guys are joining us from, because I
yeah,
see
let's see.
someone's from Canada, Pakistan.
Oh my
This
gosh.
is incredible. And I see we have a few people that are getting ready to take the NCLEX. And there was a question in the chat, which I would love to speak to, while we have a moment, while people are still joining and whatnot.
Yeah.
About the new NCLEX, which they make changes every 3 years. The last one, so I'm a nursing school instructor. I've been a full-time nursing school instructor for 10 years. So I've been a nurse for even longer than that. And I'm joining you guys from Indiana. Used to live in Chicago. So I saw someone's from Illinois, or Illinois. Originally from Indiana, so basically moved back home. That's why I can't pronounce Illinois right. But I also do NCLEX prep for schools all over the country. And again, our big thing is we love helping students and new nurses have access to things that we wish existed when we were in school and when we were new nurses. And just like it feels like you're dropped out, left on your own to figure things out as a new grad, sometimes it feels like you're kind of left to figure out your own thing in nursing school or as you're prepping for NCLEX. So the biggest changes that I've seen in my 10 years as a faculty were because they've changed, minimum, maximum number of questions. They've changed time allotment before, but when they changed the next gen NCLEX 3 years ago. But so with this new every 3 years, one of the I've attended multiple webinars, seen multiple things about this, and my overall take is calling it new. Ooh, Indianapolis, we're probably very close right now. I'm in Carmel right now, so not too far away.
Oh, snap. Nice.
Because someone said they're from Fort Wayne, but reporting from Indy. Well, and so this new NCLEX is kind of much ado about nothing, in my opinion, because the 8 client needs categories have not changed. The item types have not changed. The scoring hasn't changed. Or the minimum or maximum has not changed. And really what they've changed is they've changed some of the activity statements to make them a little bit more inclusive in 2 ways. Like inclusive as in a little bit more umbrella of a term that it can kind of include a few other things, but then also inclusive they're not going to say substance abuse anymore. It's going to be substance misuse. It's not a victim of violence. It's a recipient of violence. But other than that, there's so many components that aren't changing. Like the percentages, for the most part, of the client needs categories. The item types, which is the scariest part, which is the select all applies, the matrices, the bow ties, all of the case studies. That's all staying the same.
Wasn't there a component of EKG? Now they don't need to place the lines. Now they just have to identify.
Fetal heart monitors.
Okay, fetal heart monitor.
Yeah. They don't. One of the big activity statements was before, which again, so this is another reason why it's kind of much ado about nothing. Before, one of the activity statements specifically listed in the NCLEX test plan under, I want to say it was management of care. It said before it was that a component was you had to know how to apply a fetal heart monitor, and they changed it to be a little bit more inclusive, how to interpret and how to care for someone with a fetal heart monitor. And so maybe not the functionality of you don't have to they're not going to ask you a question of step by step, what do you do to put it on? But overall, they want you to know how to interpret what's it mean. So veal chop, essentially, which has been around for years and years and years. And, not even just, okay, if they have variable D cells, then not only what does that mean, cord compression, but also then what do you do as the nurse and, move the client. So those types of things, again, they're kind of just making it a little bit more broader terminology sometimes. So they're adjusting some terminology, make it more inclusive of even LGBTQ type things. And then some of the other activity statements are a little bit broader scope, if that makes sense.
So it's not as bad as when they drop the NGN,
Right. Where then
So
all of a sudden it's case studies, this
yeah.
unfolding case studies. All of a sudden there's all these new item types we'd never seen before, new scoring of the select all that apply, which I'm still jealous about because Mike and I didn't get that in nursing school or nurse Joe. It was all or nothing, but now you get partial credit.
Yeah. Yeah, and I think that's the biggest thing, guys, for the NCLEX. If we are we allowed to launch polls in this webinar to see how many people are
No,
taking their NCLEX? Okay.
no, not on this one, just on our webinars, but not on this one. But I did put some things for Veal Chop and then also our
Oops.
Simple Nursing Veal Chop mnemonics right there. Copy, paste, or click on that. I'm not sure how your guys' end of the chat works, but copy those. That's a great thing for Veal Chop. And you can see Mike's handsome little face.
Oh, you stop. No, but yes, if you guys didn't know, the NCLEX updates every 2 years. And so this last update is what Professor Allison's saying. It's like it's much ado about nothing. I think to do like a big overhaul every other like cycle. I know when I graduated nursing school like over 10 years ago, they had a huge update. And I think they do big updates, I think every like 5 or 6 years. So,
Mhm.
shouldn't be that big. But
Mhm.
right now, guys, we're going to be talking about some life balance because, as you guys know, you don't have a life in nursing school, and you're about to not have a life again as a new grad. So let's prevent that. Let's prevent us
Mhm.
not having lives, and let's actually like thrive without having to be a slave to our job and a slave to you know, the powers that be. So before we get into it, guys, we're gonna answer any Q&A you have, whether it's NCLEX, whether it's new grad, whether it's whatever the heck. We saw a few of you guys going into different specialties. I think someone said they were starting in mother baby, which is kind of cool. And just let us know any question you guys may have. Drop it into the Q&A, and we are here to answer anything.
I work on a
So,
mother baby unit. I'm here for you.
hey, yes. Any questions about mother baby, Nurse Joe? I totally forgot you transferred there. How long has it been now?
So since August, I've been there, and then I was on
Wow.
adult acute care for 3 years. So
Nice. Very cool. So, guys, let's balance that burnout. And I mean, Nurse Joe, you can probably attest to this, where it's like you're a new grad, you learn everything about that specialty, right? Like whether it's med surg, whether I started in ER, but then when you transfer units, you have to over again, and
it is.
that's going to be a big learning curve.
Oh yeah,
Mhm.
it's just you have to be willing to be humble and to be like, okay, I'm going into this learning. I'm not a know-it-all.
Hmm.
And
Mhm.
often when you go to different specialties, it's a whole other isolated thing. So when you're going from med surge to maybe something like adult acute care or emergency, it's like the certain critical things are just so different from one another, especially with
Hmm.
mom and baby, because a lot of things are just based around the cooker, around the
Yeah,
belly and
the
like
crock
what
pot.
does. Yes, the crock pot, the oven. And a lot of things I'm like, oh, so should we worry about this lab and this lab? They're like, no, not even that. Where it's all different. So just be willing to learn and just know it's going to be exhausting to switch specialties if you do, but it's always great because learning is wonderful and give yourself a grace period of the first year is going to be the struggle bus, and that's okay
Hmm.
because learning is not supposed to be easy. So write notes. Make sure you're always writing notes. And if you
Yeah.
don't have a brain to access, we have a few on nursing, on simple nursing. I think they also started doing some with the new grad, right? Aren't we offering like a couple brains?
Yeah, I believe so. Like, if you guys don't know what a brain is, I think everyone should know what a brain is, right? It's like one of those little templates that you write out all your vitals and all the things to do. So, as Nurse Joe was saying, um, when you become a new grad, when actually you get your RN license, guys, that's when your learning actually begins.
Hmm.
It's like all the other stuff is like kind of like elementary school or high school, and now you're going to your specialty, which is like your college major, which is kind of cool. So it's exciting, and now you get to apply all the things you learned. And honestly, you'll apply a lot of things that you didn't learn because a lot of
Mhm.
I was gonna say I was gonna say a lot of crap you learn in nursing school you don't really use. It's like learning algebra, geometry. It's like unless you're gonna be a math major, I don't know. It's
Hmm.
like you don't use half the stuff. But before we get into our first slide here about why new grads struggle with burnout, we have a question from YouTube. Um, will the Saunders comprehensive review, which I actually used when I was in nursing school, for the NCLEX RN, still work with the new updates?
Yes, yes, because again, the distribution of content doesn't change, and a lot of things haven't changed in decades. Like, you know, insert sterile technique, insertion of a Foley catheter, things like that. So that book is still applicable. Just know that again, if it says substance abuse, know that now it's going to be substance misuse. And instead of like victim of violence, it's a recipient of violence. So it's just small little nuances about like terminology. So one way to kind of get around that, which you've probably seen before on exams, is to think like, even if they're not using the exact word you've seen before, does the essence of it still hold true? Are they kind of describing what you're thinking anyways? Like, for example, NCLEX, years and years and years ago, they stopped using Foley catheter because Foley's a brand. And so instead they change it to indwelling urinary catheter. They'll never say Kleenex, it's always facial tissue. So an overall idea is always think like, even if it's not the exact word that you've seen, try to think like, does it essentially mean the same thing? And that will help you to not let that be a roadblock.
Mm-hmm. Yeah, I love that, because it's almost like majority of the times, guys, when the NCLEX does update, it's kind of like having books and textbooks, how they update, and really all they've updated was their front cover and like maybe a few pictures. It's like, is that really an update? So
Right,
yeah,
right.
the Saunders Comprehensive should definitely work.
And I think another update I forgot to mention is some states are trialing out where people can be a test person to take it from home. Not that it's like where you can be like one of the guinea pigs, but not that it will count, but you could be one of the people they start trialing it with. But it's like, I don't know who would want to do that. Why would you want to take NCLEX twice? But and because it's just an idea they're sort of floating around. But it's only some states, from what I've
like
seen
to
it at first. Oh, what you're saying?
Oh no, I was like, they always like to float around ideas for sure for the NCLEX stuff. Test things out.
Yeah, and so at first, when they were floating it, I was seeing like all these things in my algorithm were coming across saying like, you can now take NCLEX from home. And it's like, then if you actually went to NCSB and stuff and read the fine print, it's like they're going to start letting some people test run where it wouldn't be for a full score, but test run for practice.
Dang, that's pretty cool though. That's really interesting, actually. I wish I
Right.
got a test run. You know what's funny is, okay, side note before we jump into the first slide here. My carpool buddy from nursing school, he just went to go take his NCLEX as a test run, didn't even study. He was just like, I'm just gonna go see what it's about. And I'm like, dude, you just wasted like a few $100 and now you have to waste like, I don't know. And that doesn't look good for your nursing school if you fail the NCLEX. So
Right.
Sue, that's kind of cool that you do a kind of take home here. All right, guys, so let's get into the first one here. So why new grads struggle with burnout? As we mentioned before, it's your first time doing something, right? And every time it's your first time doing something, it can feel emotional. It can feel physically and mentally overwhelming. Um, Especially imagine like your first time in nursing school or your first time taking or learning about pharmacology, right? That's hard, really, really hard. So something we talk about in the new grad prep course is, guys, it's like a bell curve. Like at least for the first like 3 months, it's gonna be, it's gonna be very, very difficult for you guys to get a grasp on things. So give yourselves a lot of grace. I would write that down in your first 90 days. Just have big ears, big eyes, and a small mouth. Write everything down. Learn as much as you can. That's your goal. And as new grads, we can sometimes assume that stress is failing. It's not, right? There's always a low hum of stress in what's it called, in nursing school, as well as taking your NCLEX. And it's actually just a part of the adjustment period. So just knowing that's completely normal, it's okay. Don't fight yourself and belittle yourself when all these things are completely normal. So you guys should be fine.
100%.
And I'll kick over the next part to either Joe or Allison to take the next one here.
Absolutely. Like, and one thing that I love is like, you're so excited about passing NCLEX and so ready to be a nurse and hit the ground running and whatnot and so eager. And then you feel like all of a sudden it's like, wait, I feel like I learned nothing in school. And you feel like this learning curve when you're first starting it's like, oh my gosh, wait, and then I have to do this and this and this, and still trying like creating your own checklists in your head and doing all these things. And you think it's going to come naturally. It starts to feel like nursing school prepared you maybe for NCLEX, but not for, or maybe some experiences, prepared you for actually being a nurse. But that can sometimes even be a hit to the confidence where
Mhm.
you start to second guess, you feel like you're behind, and confidence is not built in one day. And you can be that, don't let that deflate you about your excitement for it, because you will build confidence over time, especially experience and experiences, and going through hard shifts, going through hard days, having hard patient scenarios, learning new, let's say I remember once I had a patient who had to get a rectal tube, and I was like, in nursing school, they talked about rectal tubes, but we never, we did Foley catheter insertion, but they never taught me how to insert a rectal tube. And so I went to the chargers, and the charger was like, okay, she's like, here. She walked me through it, but then she's like, I'll go in and do it. You help support. And then after that, I felt better about then the next time be able to do it my own. So just know that there are going to be there's even new stuff that comes out all the time that's created that then you'll have to learn, or even new meds that you'll have to learn about. But again, having those new experiences, that is, that first step to then building that confidence with utilizing those tools.
And take the small wins. Like that is the
Mhm.
main thing. Because if you're not paying attention to the small wins, like, oh, I knew what labs to write down first. Oh, I was faster at giving report.
Mhm.
Or, oh, I didn't dread this as much. Just know
Mhm.
dread is normal, but don't feed it.
Mhm.
Don't feed it
Mhm.
to like the dread of like, ugh, like just know I'm gonna get faster at this. Keep the small win. I remember the first 6 months, I was like, I'm going to leave on time. That was my win. Okay. Like, I am going to not take as much time in this patient's room because they tend to see me and they want to be chatty Cathy with me. And I'm like, okay, I have 4 other patients or whatever it is. Just remember, don't feed the dread, that feeling, because it can burn you out. It can, if you know that you need to exercise in the morning,
Mhm.
like I think Mike was saying that he would, or Allison, we were talking a while ago about how working out in the morning actually gives you more like oomph, more energy.
Mhm.
It kind of like resets your mind, or if you need to meditate, or if you need to take some, concoction. Mike has a bunch of those. Like you can take in the morning filled with coconut oil and whatever. Like do what you got to
Mhm.
do in order to change your mindset because other people on that unit are going to, on your future unit, are going to
Mhm.
have toxic personalities that can feed into some type of dread. And then there's going to be
Mhm.
other people that you're going to meet along your nursing journey that are going to be like intoxicatingly positive, but in
Mhm.
such a natural way. So I recommend don't feed into the dread. It's going to burn you out and take the small
Mhm.
ones. Take the
And it, especially like that dread, it can feed on itself too,
Mhm.
and it builds. And sometimes we try to ignore it or try to like, okay, even though I'm dreading this, or I'm really nervous, or, I'm dreading getting a report from this person or dreading working with some person. And I'm going to put a smile on my face, sometimes not addressing things early on, or even trying to ignore those signs. Like, okay, it's just because I'm new, it's just because I'm tired, it's just because this. It can cause it to build because then you're not addressing the actual feeling. Like so, there's been times I like blame something on like, oh, it's just because I'm tired. Or it's just because it's that time of the month. And it's like, okay, but are there other valid components that I'm saying, oh, it's this, but then I get enough sleep and I still feel that way.
And I
You
think
know?
culture too. Like Mike was telling, because had a great story about how, burnout, if you don't feel connected to your unit, because every unit
Mhm.
is going to have a different culture. So if you have someone there, even if it's one friend or
Mhm.
someone to smile with and to get through this trauma bonding sometimes, if you will, like it's a whole other experience. But if you're on like a toxic unit, like Mike has a great story about it, that burnout can come up so much easier. So, I mean, so much faster. It's just like, what
Oh
was the
yeah.
story that you had, Mike, at one of
Oh
your,
man. Yeah. A side note that we actually cover in the new grad prep course. It's really all about acting like a guest in someone else's home.
Mhm.
Of course, you're gonna be, feeling overwhelmed, physically, mentally overwhelmed. You're gonna be learning stuff, but remember, be very polite, have big ears and big eyes. I got reamed because Not because I was cocky. I think I was a little bit of I was pretty cocky actually in my mid-20s, but by the time I actually got to be a new grad, I kind of knew the game where I'm like, okay, I'm gonna shut up and I'm just gonna like learn from everyone. But it wasn't until these new nurses or these nursing students would come into the clinical rotations and they recognized me from YouTube and they're like, oh my gosh, you're Nurse Mike. And then they were taking pictures with me and like it became like a thing where like a lot of the other nurses got jealous. And once
Mhm.
you get on the bad side of one of the veteran nurses, guys, they're gonna like find a way to write you up
Mhm.
to get you out of their unit, whether it's being fired or whether it's writing you up to the board, the BRN, which happened to one of my friends. She got under a few people's skin at a new hospital she was at. They found out a medication error and reported her. So watch out. That's all I'm saying. So just know that the nursing crew, they can be very friendly and stuff, but at the same time, you're a guest in someone else's house. Big ears,
They
big
don't
eyes.
know you yet. They don't know
Yeah.
your sarcasm. They don't know how your
Mm-hmm.
work ethic. I mean, maybe you have really bad work ethic and you need to learn a lesson on it, but maybe you have a really great work ethic and you clinically think about things. But they don't know that. They're
Mhm.
like, "Oh, they're being funny. I can chime in." No, they don't know you yet. So like Mike said, just, you know, big eyes, small mouth. You can let them
Yes.
you know, slowly get to know you because until they
Mhm.
respect you, like they might just think you're annoying. And you don't want that to
Mm-hmm.
happen. Like you do you, but just remember, they don't know you yet. Give it a good 3 months.
Mhm.
And sometimes there'll be people in the unit where I'm like, I call that a 2 year person. I'm like, okay,
Mm-hmm.
I got to be here for 2 years for them to want to like not just look at my face and think I'm annoying. I'm like, that's okay.
Mhm.
It's a 2 year person. Nothing on me. They just don't like newbies, and you are
Mhm.
so accept it.
Mm-hmm.
You are a newbie, but you are wonderful and eager to learn. So,
Mhm.
Yes. Look, eager to learn is the big key. Um, and so the next thing is just rethinking the balance in real life. Remember, new grads, you guys get to be new. You often chase a version of balance that feels impossible, which leads to guilt and frustration. I've been there before. I've been there multiple times with multiple different ways. But a more realistic view of balance reduces pressure and creates space for that growth and recovery. Because, I mean, Nurse Joe, you're probably the most recent one that's transferred to a new unit, right? Can you touch on that?
Mhm.
Like, what did you do to refine your balance?
well, luckily I knew a few people that were on the unit that I was going into, but they were night shift and I've been training days. So, but I think I was putting it out there in the universe of like, okay, I really want my orienter or my preceptor just to be like kind and welcoming and to give me like some feedback when I'm doing things right. So I think for me was being able to create a relationship with the person who's training me. That really
Mhm.
helped. And to understand how they teach and how and when they want questions because you don't
Mhm.
want to be misunderstood because it's easy to be misunderstood, and that's so
Mhm.
exhausting to have to, you know, explain yourself if you're misunderstood. So I would say make sure you're getting lots of sleep. You ask if there's any brains or any type of things that you can write down or use that they would recommend that can keep you on track. And always say please and thank you to people or like, oh wow, you
Mhm.
you already know it. Like stroke their ego a little bit. It's fine. Like, wow, that's actually a really like that's a really great point of view. Whatever you gotta do, make people like you. It's gonna make your life so much easier if you're likable.
Mhm. That's so true. And it
And
looks like we might lose Mike for just a second.
Yeah,
Uh, so,
but we'll take a
um,
peek. But we can get through the next few slides and yes,
okay,
we'll see how it
perfect. In the
goes.
meantime, I'll cue it up so that way we can
Yeah, no
smoothly
worries.
transition over if needed.
Oh yeah. Hopping in, hopping out here.
and then
But
for the
go ahead.
reflecting part where it says
Mhm.
like reflect weekly on what is working and what is not, rather than expecting every day to feel even, that
Mhm.
reflecting is huge because you're the only person that can choose to reflect because you can either disregard what you're feeling or disregard these little red flags that are happening, whether it's burnout or whether it's maybe not connecting with people. Figure
Mhm.
out what needs to change for you to connect with your unit or for you to get a concept faster. Because this work-life balance of like, oh, I'm off work, not doing work anymore. Guess what? You are a newbie. If you have to study something and do some recapping or watch some simple nursing videos or watch these CEUs or do these clinical things that, this new grad, not just to promote it like it's something cheesy, but like do these new grad courses with simple nursing, you'll be like, oh yeah, I know how to do this. I just reviewed that. Think smarter. Don't go into a situation where you're not prepped because these other nurses maybe have been there for 20 years, 15 years, 10 years, 8 years, 2 years. You are day one. So your work-life balance doesn't really exist at this point because you're just trying to catch up. And I highly recommend reflecting and do your research on what you need to research more. Like, I should definitely watch some videos on these few concepts because I don't remember anything about them. Or maybe you remember
Yeah,
something.
exactly. And that's the thing. You don't have to know everything, give yourself permission to learn
Mhm.
and not to know, and also to have different priorities on work days versus days off, and that's perfectly fine.
Yeah.
So yeah, it's okay to be new. No,
Mhm.
here's a big one right here. Boundaries can protect your peace.
Mhm.
So, without clear boundaries, guys, like things get really muddied very quickly. New nurses, you guys can become quickly overwhelmed, overextended, emotionally drained, and definitely disconnected. You probably
Be
felt
a
the
part
same
of
way,
this
right, Joe?
group. Oh yeah, be a part of this group. Join this meeting. Do this not sorority, but this whatever. They're going to want you to be a part of so many different things and to possibly take on different tasks. You can say no because learning is exhausting. So if you want to be part of the unit-based practice council, cool. Attend it. Don't try to be in leadership the first year. No. Well, one, they probably wouldn't let you. But two, like if there's certain things that they want you to sign up for, as much as you want to say yes, just focus on learning right now. And know when you need to sleep, know when you need to like have your time to recharge, but don't say no to everything. But don't just know that no is an option. And you can
I
chat GBT that. How do I say no respectfully?
yeah, I think that's the biggest thing I learned is that what's it called? You can say no to everything, especially your first 3 to 6 months, That's the goal. And then I think the biggest thing that I learned once you get off probation, guys, they're gonna want you to like do overtime, and that's a big boundary right there. Because how many times are people, nurses short-staffed, units are short-staffed, they need more people, and then it's like, oh, we want you to work 6 days a week, and you just learn how to do whatever the heck you were doing, and then it's just frustrating. So that is a big boundary that I hear a lot, and we hear a lot with our new grads in the new grad prep course.
Mhm.
So the last point here on the left, learning boundary setting early builds professional confidence and just make sure that you're more sustained. Because guys, you can get burned out very quick in your first year.
Yep.
And I'm not sure if that happened to you, Joe or Allison, or maybe you guys have seen it around, other new grads get burned
Oh,
out.
oh, yeah. I had like two of the people who started in my new grad program because I did a year-long new grad program initially while being hired as a full-time nurse. And it was a year long, and I had two people, they quit. They couldn't do it. They're like, this isn't for me. I'm like, you don't want to do nursing, but you just did nursing school and now you're done. It's a real thing. People are like, I can't. I'm like, please don't. You just wasted, not wasted, but kind of like they're just done. So burnout is huge. Find your connections, find the people that can recharge you who are going through the things, or find a mentor. Mentors are huge right now inside of the hospital, things about to build culture and who your safe person is. Like, just find your people, protect your time, and because burnout is real, that dread is heavy. Don't
Oh
go.
yeah, big time. And so I think the biggest thing that we're talking about is like just practice saying no respectfully
Mhm.
when extra demands come your way. Was it hard for you to say no, Joe, when you like started transferring?
It was. It was hard because I didn't want people to think like I didn't care or that I
Yeah.
wasn't willing, but I had to figure out a way to say things that just made sense of like, oh, I totally would, but I have this obligation. Or thank you so much. I really appreciate that. I totally wish I could catch up right now, but I have another class. Or maybe we could do a future date on a different thing. Or, oh man, I really wish I had time, but can you check back with me maybe in like 6 months? My mind's on overload. Just kind of give them like a time frame, like, oh, thank you so much for the invitation. Would you mind checking back with me next year at this time? Right now, this learning curve, I don't know how you do it. Like, throw back the compliment on them. Always bring it back to them. Like, thank you so much for the invite. Can you check back with me? Give them a time frame. So, thank you, time frame, compliment. That most of the time is like the safe thing.
Or even like, saying, I want to really I want to really focus on what I'm doing right now for a little bit. So I don't want to do half, like say if they're asking you to join a unit council or lead a unit council, say, I'd love to like just be a member first or come to the meetings. That way I can get a good understanding. And, especially while I'm trying to like master all these other things. And it's not no forever. It's just, you're kind of giving them that idea of, and also giving them a heads up that you do have a full plate. Because lots of times people are so into their own components and what they're involved in. And, what I found is like lots of times bosses, they just need someone to fill that hole. And if you're the person they know that will probably say yes, it's like, it's what it is. Like doing too good of a job at something oftentimes can get you more work
Mm.
because then it's, oh, well, Allison would be great at this, or and so then all of a sudden you're on all the committees and doing this. And it's like, wait, how do I back up off of one of them because I am stretching myself too thin?
Yeah.
And
No,
that's
It's like,
I bet you have great examples, Mike. I bet you get torn in so many different opportunities. I mean,
mhm,
from going from the hospital and then now being in like not the limelight, but being,
mhm.
everyone wants to learn all these things that you're really good at teaching. Like what is your tips, you guys, on how to decline respectfully,
yeah,
but still feel liked, but also like that's okay. They can be upset with me, but it's not on me. Like
Mhm.
putting boundaries. Like what are some tips that they could use?
yeah. The one of the biggest ones that I learned before I have to transfer real quick, um, is the phrase and terminology because I was always really it was really hard for me to say no because I'm a huge people pleaser and I like to give the people what they want, which is great for YouTube, give the people what they want. But at the end of the day, it's like, you're basically it's a wordsmith, if you will. So it's like, I would love to, but not yet. So the answer is not no, it's just not yet. You know what I mean? So that
Mhm.
was really good.
Yeah.
But
Okay, so we're
how
gonna be
about you,
doing
Allison?
a little bit of a switcheroo really quick. Are we switching over the slides? We're doing
Oh
a
yeah,
little
yeah.
technical things really
I will
quick.
be
And I apologize. I was using my buddy computer, but it's not letting my buddy computer share. I saw that someone said that like not a lot of hospitals post about mentors. And, sometimes
Mm.
it's not necessarily that they're posting about it, but it's more so that there's like mentors that they have. So they may not like have a board that shows who the mentors are. And sometimes it's more so like unofficial mentors of people that they recommend.
Mhm.
So let's see, did I take over?
Yeah, let's see if you can just grab the slides. That
All
should
right,
be good.
is this one me or is this one Mike?
That's you.
Oh, perfect. Yay. Uh,
Sweet.
so like lots of times it's not that it's like they post them, some of them do, which is great. But it's not that they don't have any mentors at all. And sometimes it's just that they have people that they are using over and over again to train new grads because they're the ones that are good at it. They're the ones that like to do it, which is, you know, I feel like sometimes hospitals have the practice of like they'll give the new grads or give new nurses to the people that have most experience, but oftentimes the most experience aren't the ones that particularly like to do it and can be the ones that may seem more annoyed with questions and whatnot. So it's like
And
the
established
best.
new grad programs, they might be catching on, like teaching
Mhm,
hospitals, they might be catching on to the necessity of like these mentor programs. So if you're going
mhm,
into a hospital and you're not getting hired as a new grad, you may not expect to have a mentor. They may have in some of the units, like peer responders too, who like to
Hmm.
reach out and see how you're doing. Like, again, it's all about the culture. So
Hmm.
ask during your interviews, do you guys have
Hmm.
like a mentorship, or do you have people like how do you support your new grads? See what they offer. Because when they ask you for your follow-up questions, that's something that you like, how do I grow in the unit? What are some opportunities for growth? And then like, do you guys offer any mentorships, or do you guys offer any support for the new grads when they need time to like decompress, or how do I what do you offer? Just leave it open.
Absolutely. And especially, being open and honest about that. Cause I love, so mindset shifts especially for a healthier mindset, healthier and happy mindset.
Mhm.
Oftentimes burnout's not just because you have a lot of work on your plate, but it's because you feel the pressure to prove yourself. It's almost like internal pressure. And so sometimes there's probably been more than a handful of times where, the call was coming from inside the house. It's like I felt all this pressure, but it was pressure of my own making. No one was actually putting that pressure on me. And so trying to make sure that it's okay. Am I burnt out truly because of the workload? Or is it because I'm putting pressure on myself to be perfect? Or thinking that everyone else thinks that I should be perfect, or everyone else thinks that I should be able to do this, this, and this right now. And did anyone tell me that, or did I create that? It's
Yeah.
like, oh, well, what if I go and I've only inserted an IV on a mannequin arm? They're going to expect me to do this. They're going to expect me to be able to, or insert an IV and know how to do that and not be walked through it. And that wasn't true, you
Mm-mm.
know? And because a lot of nursing programs, even a lot of times like state boards, because of that, like, or, state regulations that it's not like back in the day when you used to be able to just, everyone could start IVs on each other. It's that can vary place to place. And so new, especially places with this, I feel like places with new or established new grad programs oftentimes have their finger on the pulse of like what you'll need more hand holding on,
Totally.
and providing you those opportunities. But definitely like having that healthier mindset. Again, it's going to take you from that perfectionism, like, oh, I need to be perfect. I want them to think that they made a good choice picking me and giving me this job. And so I'm just trying to prove myself, and then being, sometimes overly harsh on yourself. And instead having that growth mindset of, they know I'm a new grad, they know I'm growing. So the best thing that I can do is just keep trying to be a sponge and not shy away from opportunities just because I'm going to make a mistake. And instead, like even IV insertion, stopping shying away from, we had, I feel like almost every unit has someone that's like really good at hard sticks.
Hmm.
And so if there was a patient that I knew was a hard stick, I'd go up to that person, like, can you do this for me? And instead of doing that, actually trying myself.
Yeah.
Sometimes trying, even because then that helped me gain so much confidence when it was one that I wanted to shy away from because I didn't want to fail, versus trying and sometimes not being successful, but then over time, more often than not, I was. And that built so much more confidence. So definitely, and also just not being so hard on yourself, having that grace, like Mike said, giving
Yeah.
yourself grace.
The progress over perfection. And sometimes things change. Like I used to be really good at IVs, but I was, placing 25s, 22s, 20s. Now in my unit, their standard are 18s. And I'm like, oh, I just I
Mhm.
always just flop them. It's just like I
Mhm.
was doing them all the time, and now I'm barely doing them, and now I'm doing them more. And I'm like, geez, 18s are a little different. And so just progress over perfection. But
Mhm.
side note, thinking of progress, somebody passed their NCLEX and said, I use simple nursing. Thank you to the team. Many thanks to Allison. And I'm sure me, because I was there too at a webinar before my exam. You gave me some guidance. Love that,
Oh,
Zoka.
we love, love, love to hear that. We're here to help you guys. And so we love hearing that anything that we said stuck. I was just talking with a student earlier, who was like, I was taking an exam, my other course, and I heard your voice in my head. I was like, oh God, like, I have my own voices in my own head, and so I was like, they're like, no, but it was in the best way. And it helped me so much. And it's like, that's why we do this. We actually have a great comment in the chat. Someone said for them personally, imposter syndrome is so real, and which is so common
It
in
is.
so many different aspects. And especially sometimes it's like, you're like, okay, well, I feel like, okay, they hired me, they believe in me. And now like, I feel like, well, what if I don't end up panning out in the way that they're thinking or, and oftentimes we think the worst things about ourselves,
Yeah.
you know, and, but especially this is a great component of that they're applying to a nurse residency program. If they're accepted, they're locked in for a year contract. Is that common? That can be, especially with other times when being or where you don't reap the benefits until you're there for a certain amount of times, like sign-on bonuses. I would say the nicer the sign-on bonus, read the fine print, because oftentimes it's like you got to stay for a certain amount of time to get certain chunks of it.
Yeah.
And so that can be common, but especially if it's if it's a residency program, oftentimes, they build those because it costs the hospital a lot of money to orient a new grad. And
Yeah.
so they want and they hope that you have they're invested in you, literally, but also you having a good experience and not just leaving after a year. Or,
Yeah.
or not just like leaving because then they got to start training someone new. It still costs the money to train someone who's not a new grad, who's an experienced nurse. Uh, Not as much, but and so especially like, you know, they should be invested in your happiness and that you're going to sorry, choking on my own spit, and that you're going to end up working out because it's a win-win. And so it's not like they're locking you into a death sentence, but and especially if it's a program, they're investing a lot of time and resources into you. And so they want you to, stay and not just like use their resources and leave. And now you've got some experience and you go to another hospital and the other hospital benefits from what they invested in you.
And like give it a year. Like honestly, the
Mhm.
dread or that burnout or not connecting or the fact that it's just a
Mhm.
struggle bus the first year. Honestly,
Mhm.
over 3 years, you're still gonna be a newbie. Depending on what
Mhm.
specialty, it may take 5 years. So like give it a year because you may be thinking differently in a year. It looks better that you were at somewhere for a full year and you completed something.
Mhm.
Um, just give it time. So don't jump ship right away because maybe, you know, think of the little tips of I'm just not understood or like think of progress over perfection, not like I just
Mhm.
can't get it or like I can't handle the poop smell. Then double mask it and put some toothpaste in between your masks. Make it happen.
Mhm.
Like figure it out. Do what you gotta do in order to like mask the things that are just dreading. Because guess what? A year isn't that long. You can do anything for a year and it looks better and you'll
Mhm.
learn more because maybe you were put there for a reason. I know I was
And
put on my last unit for a reason. Glad I'm not there
well,
anymore, but
well, and I
it's
feel
hard.
like every job I've ever done, it's you have that initial honeymoon phase where
Mhm.
you're so excited, and then it's like usually around like the 6 month, 3 to 6 month mark, or maybe even like 6 to 9 month mark, all of a sudden the honeymoon phase is worn off, and you start to think like maybe this wasn't the right choice, and then oftentimes that stabilizes out, you know? And so, know that that honeymoon phase, the so excitement, it'll wear off especially as fatigue sets in. And but still trying your best. And then especially once you gain that confidence, it helps so much. And there's something special to be said. Like after that 6 month mark, you start to like feel like the learning curve's not like this. It starts to plateau a little bit, where there'll be times you have shifts that rock you and you learn a little more. But then you start to feel like, okay, wait, I think I feel like I've got this. I've got my feet up, my feet are under me solidly, versus you're getting the, floor just pulled out from under you.
And also like night shift. Like isn't I know that there is if you're emotionally drained or you're like, man,
Mhm.
my mental health, I just don't really like this anymore. Most of the time as new grads, you will go to night shift. There are times that you don't have to. I
Mhm.
haven't had to yet, but I will be doing that. But I know that um the night shift, like mental health, it is it is rough as far as like
Mhm.
being able to protect like man I'm depressed or man I'm this or I'm that. You got
Mhm.
to figure out ways to make it not that because
Mhm.
you will start to relate your mental health with this is the profession I don't want, rather than,
Mhm.
oh, I'm being affected by being a night shift nurse. I need to figure out ways that I can get better sleep hygiene, or I can get
Mhm.
outside, or I do certain things, or maybe my body has to acclimate. It takes time to acclimate to things. So just remember, it may not be a regret of the
Mhm.
job or the unit you're in. It could just be that my body's not calibrated to sleeping
Mhm.
during the day. How do I change this? What vitamins do I need to
Mhm.
take? What is it that I need to change? So look at the whole picture
Right.
before
Or even like
making it.
try also, focusing on some of the positives. Like anytime I got frustrated with night
Mhm.
shift, I would be like, okay, but I'm making this much more an hour for working the same number of hours a week. And that's allowing me this, or, treating yourself because of that. Uh, like, okay, well, I'm going to treat myself with this because I worked the same amount of hours as someone who works day shift, but I got paid this surplus just for working a different time of the day.
Yeah,
Oh.
because where your focus goes, your energy flows. That's what Mike always says. So like, in respect to this, like Allison's saying, focus on the positive, not the negative, because your
Mhm.
brain is naturally wired to think more negative thoughts
Mhm.
than positive thoughts if you're constantly feeding it certain things. So give
Mhm.
it positive energy and give it positive thoughts. Retrain your brain, and it will actually start to produce more positive outcomes. And if other
Mhm.
people are Debbie Downers, don't be the Debbie Downer. You can laugh or whatever you want to do in order to survive that. But just remember, you are you, and
Mhm.
you can bring laughter and joy and positivity to any
Mhm.
situation. And you can be the smart one. You could be the one who researches something. You could also be the person who says, no, thank you. Check back with me another time. So protect yourself, make a difference. And it may just take a while to build that habit of sleeping
Mhm.
enough. um, and give yourself grace. Recognize those self wins.
Well, especially like any of those negative thoughts, replacing them,
Mhm.
replacing them instead of, like thinking, oh, I should already know this. I should already be faster at this. Think again, replace because it's hard to like thought block. Like, I'm just not going to think that way. I'm just not going to think about that. And
Mhm.
instead think, okay, you know what? I'm still learning. I'm still new. I get to be new. And so, especially then the last bullet point here, building that self-compassion. And instead of replaying every mistake, insecurity, overthinking about it, uh, and like, just not letting it go, have that self-compassion and know that you're learning. Because even from some of the biggest mistakes and hardest shifts, I learned the most.
Yeah, it's a real thing. Just have that self-compassion because other people might learn something faster. And if you
Mhm.
know that you take a little longer, that's okay. And it's hard. It's a hard pill to swallow when you're like, I'm just don't get it as fast as they do. But that's okay. You'll get your zoom afterwards. Just be a safe nurse. Be a safe
Mhm.
nurse. This is why you're here. Protect your license. Just, it's all love.
Absolutely. And especially some things that can keep you grounded on a daily basis. Cause it's, those marginal gains every day doing a little something that builds over time, the aggregation of marginal gains.
Hmm.
And so oftentimes by just doing those small shifts, then over time, like if you try to do anything, if you try to make huge changes, lots of times that's hard to sustain. But
Hmm.
little small shifts over time, especially like Joe was saying, like say if it is that you're working night shift, making small changes like adding blackout curtains or start being your own personal manager where you're like, okay, no, even though I want to stay up and keep watching another episode of a series of Netflix, I know I need sleep and I can watch that tomorrow. So, but I need sleep today before my shift and the time's going to move forward anyways. And so it's what you're doing with that time. And so especially anything that supports your own emotional recovery, well-being, physical well-being, feeling like the situation isn't out of your control, that the locus of control is also inside of you. So
Yeah.
even things like my or like Joe said earlier, um, I noticed that I think before I always like to like work out at the end of the day, but I realized after the end of a shift, I was already wiped physically, mentally, emotionally, and I didn't have the motivation to want to do anything else besides rot on the couch.
Yeah.
And I started to find that even just by, doing a little something before work, besides just rolling out of bed, putting my hair in a ponytail, brushing my teeth, and getting my caffeine in, if I, because, went for a walk or moved my body in any way, I felt more awake than actually that Red Bull, than having a Red Bull, because it, gets your heart pumping and anything like it can build some of that excitement and release some serotonin too, and release some body stress.
And the meal prepping stuff, conversations we've had
Mhm.
before, like
Mhm.
prioritizing, oh, I'm not going to go do takeout,
Mhm.
or I'm not going to go grab something at the hospital. Like I'm going to prioritize the protein and the certain essential things to
Mhm.
eat because that's going to fuel your body and it's going to make you feel better. And hydration, ooh, I am battling it right now. Which one do I drink? And it's like, okay. But like hydration is huge. It is so huge. But just find those essential recovery tools, like whether it's going to the spa or sitting in the bath with some Epsom salt, or maybe just driving home with it quiet and just pushing cancel on the phone calls that come in. You
Mhm.
just need a minute to just reset. Like,
Mhm.
that was a rough shift. I'm just gonna brush it away. Or like, I can only
Like
control what I can control.
I love what you said about like pressing cancel or pressing silence. Like I found that like I had to take off my Apple Watch, even though it wasn't going to get my activity. I might not close my circle for the day. But because even just like the stimulation of feeling that I'm getting a text, that I'm getting an email, um, I needed to disconnect. And so even just doing things and having a routine of like either like music, journaling, going for a walk, um, or reading books, things like that, before jumping into like big responsibilities. Because when you're already like feel like you're maxed out from work, nothing can set you off by then having to like do something else major. Like, okay, now I have all this laundry to do and whatnot. Um, or out your outside life like needing so much from you, it's like, okay, I feel like I'm getting pulled in all directions and I can't do everything and be everything to anybody. Again, caring for the caregiver as well, you can't fill from an empty glass. So uh
Love that.
look at those things as like there's so many times I've learned to really appreciate like the couch rot times. Even though on your day off, I would have like all these things I want to do on my days off. I wanted to run this errand, do this, do this, do this, and would find so much more out of like letting myself just like watch TV, nap on the couch, couch rot, and be a total couch potato to let my body be rehydrated versus like, okay, and let my body be refueled versus then there's times where say if I had a few days off in a row and so I'm going to go and visit this friend and do this thing and stay up too late and then I'm going back to work not feel I needed a weekend for my weekend, like
Yeah,
just to
loving
recover.
that. Yeah, it's that definition of product. What was a productive day? Like what was
Mhm.
productive? Was that couch rot productive for your resting? Yeah,
Right, right. And it's like I refuse to feel guilt tripped about it,
yeah,
because you can only do so much. And so especially just having like small moments where you breathe, reset, feel like you're reconnecting with something, even if it's just reconnecting with uh, your favorite show, reconnecting with a book. Sometimes it could be a phone call with a friend.
yeah,
Like especially I would call my nursing school bestie, and we worked at different hospitals in different states. But sometimes even just calling her, and sometimes like it doesn't mean like it's off limits to talk about the work stuff, and because sometimes like having someone else to talk to and vent to, and I'd hear stuff that she'd tell me about where she was working. I'd be like, okay, well, my place isn't so bad. And she probably heard things that I said that she was like, oh, that's awful. I'm glad my place isn't like that.
yeah,
But that even helps too.
yeah. Love all that.
So
And it,
then, well, oh, sorry, go
no,
ahead.
no, no, go ahead.
I was gonna say, but then what to do if you're like, okay, these are all ways to, like prevent it, try to keep it at bay. But what if you're already in it? What if it's already hit? And especially if you're in it, if you're already feeling overloaded, stressed, it doesn't mean that you're not right for nursing, doesn't mean you weren't meant to be a nurse, doesn't mean that you spent all this time, money, years doing education and stressing about that. And then now you're like, okay, maybe this was never for me to begin with. And now what? It oftentimes just means that you've maxed your own capacity. And it could be that maybe it's that unit might not be right for you. You know, because like nursing, there's the one of the coolest things about nursing is you can do so many different things. Like I
Don't have to
never
be
thought I was
bedside. You can do
right.
anything.
Right. It doesn't even have to be bedside. Right. Absolutely. Like I never thought that I was going to be an instructor. And now I'm like, oh my gosh, I love it. Um, and so, especially addressing it early can help prevent any like deeper emotional exhaustion or where you start to like feel disconnected with the profession as a whole, or just detaching from the job people, you know, like if you find that you're like dreading going to work, you're trying to like, you're waiting till the last minute to leave and get in your car, and then you're stressed because you're in traffic and now you're afraid you're going to be late, but it's because you were dreading even just starting and going to begin with.
Yeah.
Um, and it can cause you to have like longer term just not being happy.
Yeah. You just have to be honest with yourself. Like, look at the
Mhm.
signs and identify those signs. Like, we tell people on the NCLEX webinars, like, when you have testing fatigue, we want you to identify those signs. Look for those warning signs, like, oh, I am having a hard time getting up. Whoa, I'm thinking more negative things, or I'm not sleeping as well, or I don't have
Mhm.
one on this unit, or maybe I'm the grump. Instead of just taking it too hard on yourself, just change it. Switch
Mhm.
it up. Create better habits and look for someone that you can trust. And maybe your friends and family who aren't in the medical field, they may not get it. Like look for someone that, whether in a different state, like Allison was saying, like she called her other friend, they get it. Other people are like,
Mhm.
what do you mean? You just work 3 days a week. 3 days a week.
Right. Be like, you only work 3 days a week. It's like, are you kidding me?
Like,
I feel like
I
that's
know.
like running 3 marathons in a week.
oh yeah. I'm like, why do
I
I
just
feel
want
so
to punch people in the
expanded?
face for that.
Yeah.
Right, right. Like, aren't
But
you
yes,
bored? No, I'm exhausted.
I'm
Yeah.
exhausted. So, guys, we have exhausted all of our slides. I'm back on, but let us know your Q and A's inside of you know if you guys have anything at all. We are a captive audience for y'all, just to
Mhm.
help you out. Um,
Oh, I have a
but
thing that
yes,
that
go
would
ahead.
be great is that I remember going from nursing school and then, going to NCLEX and then starting my job. And I'm like, what do they mean by CEUs and what do they mean by like these things I have to maintain? I can't really wrap my head around that. I feel like understanding that you need certain amount every year or every, like maybe not your first 2 years because we need a certain ones, but because like your first time renewing your license, you don't necessarily need it, but you need a couple different classes. Like how would you guys describe that in the sense that the importance of the CEUs?
Oh, and CEUs especially, I remember at first being like, wait, I just got out of school and I have to keep doing more school, which sometimes jobs can facilitate it, sometimes it's on your own. So even you have to figure out, okay, when am I going to plan this? And you don't want to wait till too late because then it's like, wait, I got 20 hours to do and only this many number of weeks. That's like having a part-time job,
Yeah.
or only having a month to do it. So especially doing it a little bit often. And sometimes, it depends on what facility you work at, depending on where you're working, is if they'll provide you some of those resources or those opportunities. Because sometimes you have to go and seek them out and take the time to do them. But a lot of times it's like it can go from something like, oh, I have to do this to like, wait, I'm glad I actually did that. Because you can learn something new and help
Hmm.
to grow. You can even get CEUs on how to avoid burnout. Like there's, so many different courses and opportunities. And luckily, especially like with you can get CEUs for watching the new grad prep course that was developed. Mike's baby that he worked on for so long. And so that's another great way to do it. And, uh, and so especially like doing those things and getting those through, and even like, that's another way to bond with other people. Like, what are you doing for CEUs? Oh, do you want to like get together and, over coffee, do this together? Like make it more fun.
And we actually have a discount code for you guys. It's new grad nurse. It's going to be grad 20. So you actually can get 20% off of this membership. Obviously, this is the sales pitch time, but you're going to have to use them anyways. So here's this, and just know this is, Mike's baby. He's been so excited this past, what, like 10 months ago you launched
Mhm.
it? Oh, how long ago
Oh
was it?
man, it's been like almost 2 years in the works,
Yeah.
and I just think it's fun because it's like, man, no one ever helps you after your NCLEX, right?
Mhm.
Like Archer, UWorld, all the rest, Kaplan, that no one cares. I'm like, dude, that
Mhm.
sucks, man. That's
Like, bye,
so
Felicia.
yeah. And so we just put everything in there that we wish we would have had in our new grad prep course. So Allison, if you can just go 2 more slides down.
Mhm.
Yeah. Um, yeah. So once again, guys, you have a license to maintain. And I can give you some tips and tricks about how I like to maintain my license, because in the hospital setting, you guys are given so many free CEUs, like around like your units, at least the unit that I was on. But sometimes you still have to kind of piecemeal it together, and that's why this is really cool. With you guys take our new grad prep course, not only are you learning, you get a skills refresher library with over 100 skills training videos, which basically all we did was we took like the top skills from every unit, med surge, ICU, and ER, and we put them into 60-second refreshers, which is really cool. And we put it all into that one location for you guys. So, for example, if it's your first time doing IV, or if it's your first time doing a Foley catheter, then it's like, I don't know how to do that. Instead of looking at random videos that are long as heck on YouTube, we put it there for 90 seconds, everything you need to know, and just quick. So, and that's one of the best features we have.
And it's
Um,
current. A lot of things change, and so it's up to date, so things that they may have done 5 years
yeah.
when they posted this video, it's actually contraindicated now. So
Oh my gosh, yeah, like inflating the Foley bulb, before you insert it. So yeah, that kind of thing. All right, guys, what other questions do we got here? I'm actually going to switch over to my desktop here.
Oh, we have a really good question in the chat. So, do you guys, and we go over this in the grad prep course. Do you guys recommend starting off at med surge or starting a specialty you like if you can? Also, is it crazy going to the ICU as a new grad? I hear this question so often. I feel like and it's been around for a while. When I was in nursing school, I feel like all my clinical instructors were saying, like, as a new grad, you should expect that you're gonna start night shift. As a new grad, you should start in med surge. You're never like, don't expect to start in the ICU or ER. And I feel like that's such an outdated mentality and thought process where, especially because of like the nurse shortage, there's opportunities for new grads in night shift, day shift, everywhere. But we actually even like looked into how many new grads, what area did they start in? How long do they stay? And if they left, why did they leave? And so like med surge, lots of times it was like people left because they just took that because they felt like they needed to start in med surge, but that wasn't really where they wanted to land in. And so but they were told or thought. I started in med surge, but it was because it was the first job opportunity I got. I ended up liking it. Uh, and so there's such a variety, but definitely, you know, go where your heart leads you. And sometimes it can be what opportunities you get first. You'll never know what you like and what you don't like until you try it, oftentimes. And it could be you even, let's say you get your dream area and then you're like, wait, this is not what I thought it was, and I actually don't like it.
Yeah. So many people go into nursing school like that, where it's like, oh, I'm supposed to be a blank nurse. I don't know, an ER nurse, an ICU nurse, some other baby nurse. And then even my carpal buddy, he didn't even know he liked pediatrics, and he like really liked pediatrics.
Mhm.
So he got into it, and he's like, dude, I didn't know I like pediatrics or psychiatric. And I'm like, whoa. So many times it's like you can be set on one thing, and um just let yourself, the world's your oyster. Let yourself,
Mhm.
uh, you know, what am I trying to say? Let the joy be in the journey instead of like, oh, I gotta be this certain thing.
Mhm.
So
I love
yeah,
that. Let the joy be in the journey. I love that.
yeah,
Mhm.
the
Hmm.
joys of the journey. So yes. But yeah, any
Trace?
NCLEX questions or anything? Okay, let's see here.
Oh, and
Sally.
I'm going to keep trying to where I think and feel like I belong. Absolutely. And again, I've even heard of people who were from day one die hard. They want to go in labor and delivery, and
Hmm.
then they tried that and didn't like it.
Isn't that
Nurses
crazy?
that I right,
Yeah.
nurses that had worked on the unit that I started. That was my first job. They had been there for a while, and then they one switched to ICU, one switched to labor and delivery. So even if, let's say, if you've started an area, does not mean that you are then, you know, captured and held to that. You can always still shift and change, which is another great thing about nursing. Because there's,
Hmm.
if one thing is not for you, then, try on a different shoe size.
Yeah, and if you're like for me personally, I got into a hospital. I told myself that I do not want to do med surge
Mhm.
or adult acute care. Adult acute care and med
Mhm.
surge, they're similar, but adult acute care, it's like the acuity is a bit higher. You just don't have
Mhm.
pressors. You know what I mean? Like it's you have every type of pump, you just don't have pressors. It's not ICU, but guaranteed they're probably going up there or they just came down. But
Mhm.
I knew that I wanted to be at this teaching hospital. So it was like, you know what? I'm going to put my time in because I know I want to work on a different unit, but I'm going to absorb as much as I can because I want to be at that level one trauma center that is known for education. And we get the, my floor would be an ICU on a different,
Mhm.
at a different hospital. So if you
Mhm.
have to put your time in, put your time in. And if you're like,
Mhm.
hold on, I want to get into the specialty because it's easier for them to hire a new grad
Mhm.
in that specialty unit, then do it. Or say that you need to become a volunteer for that
Mhm.
for the 6 months in order to get to know the unit. And you're not
Mhm.
practicing as a nurse, but you're practicing as a volunteer because you're getting to know the people, getting to
Oh
say
yeah.
like, oh, they're likable. I want to hire
Mhm.
them. Like, do what you got to do, plan it out, but also be open to like, I may not know that that's what I
Mhm.
want to do yet, but I know I want to be
Yeah.
there.
And that's the beauty of like working in the hospital before getting hired as a nurse on that unit. You get to see the culture, you get to see the personalities. So I always recommend anyone in their last semester or closer to, graduating, if that's you
Mhm.
guys, then definitely work on the unit, that you want to work in.
Mhm.
We have a great question from YouTube about time management tips. Now it's funny because they're asking for time management tips, but they state that they started using macros for charting,
Mhm.
and macros is a computer system, right? Is that like, or what does she mean by macros? Is that like a Meditech or is that like an Epic or no?
Uh,
Anyways, she said she started using macros for
mhm.
charting, and if she had multiple patients, um,
Mhm.
if she had a patient multiple days in a row, editing where they needed or where she needed, that
I
really
mean, like a
helps.
dot phrase, maybe? Like she was using
Possibly,
like a dot phrase in order to cut off on the charting stuff. Um,
maybe. Um, but they
I
state
would
that their
say,
clustering care is better, which helps. So, oh, good.
yeah, honestly, the brains. If you're like, if you can ask your unit, like, hey, does anyone have a really good brain that they use? Or I always ask this, how do you set up your day if you're training with
Hmm.
someone? But like,
Mhm.
how do you write out your patient report? Because I would always teach, I love teaching. My first career, I was a teacher. And then I changed careers and now I
Mhm.
help with civil nursing. And then I also am a nurse. So my main thing was this is how I set out my whole brain. This is how I write up my whole, this is how I take report. This is how I give report. This is how
Mhm.
I write down the essential information. So then I know throughout the day, this is what I did. And then I know what's left to do, or this is who I need to, I'm not just going to wing it. So depending on what unit
Mhm.
you're on, you could even, I recommend, yes, I highly recommend when you're training, do it
Oh,
how
yeah.
they ask how they do it. How do you set up your
Mhm.
brain? How do you take report? How do you give report? How do you keep yourself in order? How do you know what to do next and keep you
Mhm.
on time? Like by breakfast, I know I'm going to be doing these things. I'm going to check all my sugars
Mhm.
first. I'm going to make sure that I have my pen, my insulin pens, and the med cassettes for my patients.
Mhm.
I know by noon I'm going to have my head to toe already charted for
Mhm.
2 out of my 5 patients, or all 5 patients, or 4 patients. I know that I'm going to be checking in. This is how I'm going to stay on top of my PRNs, my as needed and requested pain meds, because I know pain meds are huge. This is how I double check. Always ask them, how do I stay organized? And how do you, because being organized is how you're going to help with time management. It's all about being able to document quickly and also know what you have to document, because if it's not legally like known as that definition, you shouldn't be documenting it. You need to be
Mm,
concise, and you need to always ask, is this legally appropriate for me to be documenting? And if you're not documenting in a reasonable time frame, you got to work on your charting, because they will know if you're charting and you're on your phone. Like, I've seen like some cases of people are like, oh yeah,
really?
I provided this care. I was in there. I was doing this. I was doing that. And then they actually were able to access like where they were at on their phone. And actually, the time they said they were in there giving certain care, they weren't. They were actually somewhere else not doing that.
Whoa.
And actually showed that so don't connect to that Wi-Fi. They're going to be tracking you. And don't ever falsely say you did something and you didn't. Like, be on time. If you're slow, maybe you have an inappropriate, like too big of an assignment. That's something too. But like, hey, this is just too much. Talk to your charge nurse. Talk to whoever you should be talking to. But like, this is just
Mm.
too much for me. How do I manage this? I don't know how to stay on time. I'm just way behind. So make sure that you have an appropriate assignment. Don't make a big deal about it at first. See if you can handle it. But if you can't keep your license protected and safe, and you can't keep up, you need to talk to someone about, hey, can someone support me? Um,
Oh,
because
yeah.
time management is huge, and it comes in time. It
I
comes in
even
time.
I, I even heard our nursing professor talking about how she denied patient assignments
Yeah.
because she was like, that's unsafe, you know. They were
Yeah.
saying like, oh, you worked ICU, usually it's 2 patients, but can we give you a third one? They're very like low step down. It's like, no, because this is my license. If I'm overextending and accepting this, unsafe assignment. Another case, guys, is like, let's say like, Joe's in Mother Baby, and this person's only been in Mother Baby. Now they have to float around the hospital, right? And then now they have to take care of a cardiac patient, like a heart attack patient. They've never taken care of one before. Is that safe? I don't know.
No,
So
because
that's what
maybe they're
that's what we're
not
trying to say.
certified in tele. Like I'm certified, but like,
Yeah.
and Mike's a wizard. He used to teach all about your
but
stuff. But like,
but Mother Baby, I wouldn't be like, what the heck do I do here? So,
right? You're like, what's that?
yeah. Like what is going on here? You want some
Yeah.
milk?
Hey, what? Why?
Okay. Well, okay, wait, hold on real quick. Cindy asks, do you recommend being a home health nurse as a new grad? My area is very saturated with new nurses, and residencies fill up almost immediately. Looks like a few people are struggling to land a job. What would you guys recommend here? What do you guys think?
I took the first job opportunity I was given because I was like, I just need to get a job. And again, I ended up loving it, and I ended up working in med surge for the whole time I was a med surge nurse, or that I worked bedside. And because I found, I was like, you know what, I really like it. I like that I get to use skills. I like that it's rare I'm bored. I'd rather be bored than busy. And so it ended up fitting well with my personality. But let's say if you do take like home health, for example, and you're like, well, it's mainly because I need to get a job. I want to get that year of experience, so that way I can then go and get something that is an area that I do want to be in. You can absolutely do that. I was the preceptor for one of our new hire nurses, not new grad, but new hire. And she had worked in home health for 3 years and then wanted to come work bedside at the hospital. And so it was definitely like we worked on different things because it's a shift in like mindset, it's a shift in time management versus you're going to someone's house and focusing on their problems and their issues in that one moment. It's like now you have 5 patients and we got to plan and plot our day. Uh, so that's absolutely, you can start in one area, find an opportunity,
I
And
do
because
have
then
a hesitation though about home
Mhm.
health as a new grad. I would
Mhm.
definitely like I agree with everything that
Tell
Al's
us.
saying. I agree 100%. It's a different pace,
Mhm.
but how long are you going to be trained? How long
Oh,
are you
that's a
going
good
to have
question.
Yeah.
someone with you? Because if you're in there solo and
Right.
you don't know what to do if
Mhm.
something hits the fan, are you
Mhm.
equipped to do so? Are you do you know the meds safely that get
Mhm.
them for their age and their conditions? Like, I would
Mhm.
just make sure that you ask, because I think home health would be wonderful,
Oh
Mhm.
yeah.
but you, as a newbie, you need to ask, how do you train and
Mhm.
Hmm.
how long are you going to have someone with you? Because
Absolutely.
if you're solo and something happens, do you know how to do ACLS? Do you know
Mhm.
how to what not to do? You can't give that
Mhm.
amount because they just had another medication that is actually, their BP is really low and they just had it recently, or they can't do it because they actually took this in 2 hours and it kind of contradicts that. Like, I would be hesitant. Um,
But that goes for any new grad job because I'll
yeah,
weigh in on when I was in the ER, my preceptor did everything for me.
yeah,
Everything. She didn't even let me learn. So the guys, that's a huge like testament right there to like what there's it's not just, home health. It's really advocating for yourself
yeah.
Mhm.
because I was about 2 to 3 weeks out of being on my own as the own nurse, and I still hadn't hung blood. I've only really started IVs and did Foley's. I was basically a glorified CNA or a tech, and I was a tech for
Mhm.
years. And I'm like, guys, I don't know how to do my basic assessments. Like the preceptor was only doing it because she got time. She got to put on a resume to be a flight medic or a flight nurse. And I'm
Mm.
like, dude, so I had to raise my hand and be like, talk to the charge nurse, talk to the director, and be like, yo, you know, I need I need help here because I don't feel safe and I'm gonna hurt someone. But the same thing goes as a home health nurse or as any nurse,
Mhm.
Just
Mhm.
so that's a really good point, Joe. Like ask what your what
Or
the new grad, what is it called? What am I saying? The preceptorship. What does that look like? Yeah.
yeah,
Mhm.
at least you
The
had a
onboarding.
unit. Like, you could call someone for a rescue team, even though you are the
Yeah,
rescue
it's
team,
true.
but you could have someone. But what if you're there by yourself?
It reminds
Right.
me as a paramedic. I'm like, I was always by myself. So it's
Right?
like, but that's what I mean. It's like, but that's the thing. It's like you're the back of the unit, you're the back of the
Mhm.
ambulance by yourself. So at the end of the day, it's like you need to get trained the right way, just like Joe was saying.
Mhm.
But
Protect your license. You worked hard. You worked
okay,
so hard.
let's just say you do get trained the right way. It's like a robust onboarding preceptorship program. Do you still think people should start as a new grad in a home health nurse or in a even a nursing home? What do you guys think?
Nursing
And
home, I think, sure. I mean, that's
yeah.
gonna be hard, but sure, it's gonna teach you time management, that's for sure.
Mhm.
Yeah.
Home
And I
health.
think if they have a really good support system or like, especially if you're following someone for a while, but then they start more like shadowing, taking the back seat, so to speak, of like still there with you as support. Or if they have like, okay, if you need support, have a question, here's who to call, here's what to do, da da da.
Hmm.
Because again, that the nurse that I was training, that was her first job out of nursing school, and she ended up working there for 3 years. And
Wow.
she was like, but I'm not getting any younger. And so if I'm going to go bedside, I can always go back to home health. If I'm going to try bedside out, I want to do it now while I'm, still young, kind of thing. And so, and she had no complaints she said she really liked home health and there was a chance, later on she was going to go back to it. But so it sounded like she had gotten a good experience and
Yeah.
just wanted to try something new that she originally thought she was going to, and wanted to still come back to that. So
And know
especially
your
when someone,
scope. Like, you
right.
understood like what you were able to do and what was not. Like, if they're like, here, can you trim my toes? It's like, actually I can't. Like, I'm not a podiatrist and you have diabetes and I actually can't actually
Actually, do you want
trim
some?
your nails.
Yeah. Do you
Yeah,
want
like
some? Which kind of nail polish do you want on that?
yeah, like, I can paint your nails, I just can't trim them. Or I can't,
Yes, yes, yes.
sorry, I can't do these certain things because people will ask and you'll want to help. But if it's
Mhm.
not in your scope, you can't
Yep.
be picked.
But there's so many little nuances that we didn't
Mhm.
know as a new grad.
Yeah.
And that's
Mhm.
why we packed it out with like dozens of videos for you guys in the new grad prep So not only do you get
Mhm.
CUs, you get 100 skills, you get interview questions from, the managers themselves, and you get a behind the scenes peek at what preceptors look for in new grads, where the
Mhm.
common pitfalls are, and all of it, as well as how to balance time management, burnout,
Mhm.
self-care, med surge, ICU, all the things. So guys, here is your discount QR code here, and Grad 20 should definitely work for you guys. Just in case if you guys are sticking around to the end of this. But sorry, I didn't mean to cut you guys off. What else were you guys saying about things and the stuffs?
Oh no, that's great. That was great.
Mhm.
Cool. But yeah, I think the moral of the story is be kind to yourself because you only get to be new once. You only get to take the NCLEX and pass it one time, right? You never have to pass the NCLEX ever again once you pass it one time.
Mhm.
So if you guys are
Just-
struggling with the NCLEX or NCLEX prep, join us, please. Or
Yeah, because as I say, someone that's perfect timing. We had Celeste said, any tips on taking NCLEX? My appointment is next month. Definitely come to our NCLEX prep webinar, our NCLEX cram sesh
yeah.
webinar. We also have the videos on the Simple Nursing platform of our previous ones, but we break it down how to know when you're ready to sit, what to do to get prepared and know that you're ready to go, what scores to be hitting, how many questions to be doing. We break down question types. We do all the things. So definitely join us for that if your appointment's next month. But one of our biggest tips is always train how you're going to have to perform.
And I
You
Mhm.
know,
dropped the link in there too for you guys to sign up.
Sweet. I don't know
awesome.
why I can't click
Thank
it. I don't
you.
know. It's
Oh,
weird.
just copy paste it.
Okay.
Yeah, sometimes Zoom does that, depending on what webinar chat or whatnot. Just copy paste it. Yeah.
What it's very cool. I like it. Well, that's amazing. And so yeah, just to recap again, you guys only get to be new once. Give yourselves a lot of credit and a lot of patience and advocate for yourselves, man, because being a new grad is definitely scary. You have a license to maintain and you want to have the best training possible because the worst case scenario, you can get written up, you can get
Mhm.
a ding on your record, they call it, with the BRN. Like one of my friends, Nurse Sarah, she was kind of a loudmouth, I will be honest. She was kind of a know-it-all. She was one of those, she was supposed to go fire and be a firefighter. So
Mhm.
kind of like an alpha, kind of person. And she started a new unit in Ohio and got under a lot of people's skin by
Mhm.
telling them what to do. It's like, oh, well, in California, we used to do the A, B, and C. You guys are doing it wrong here. It's like, dude, that's the last thing you want to do in someone's, house. So
Mhm.
don't be the know-it-all. Don't be like, well, and the most updated, because I'm fresh out of nursing school, the most updated thing on the NCLEX is beep, 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 beep. Guys, don't do that. Be like big ears, big eyes, small mouth, unless someone's doing something,
Unsafe,
dangerous and
unethical, illegal.
yes. Yeah, like I saw a nurse one time, um, totally break sterile field doing a Foley and didn't care, just threw it in. I was like, oh, snaps. Like that
Yeah.
was crazy. And then another
Mhm.
nurse got, yeah, so it's the Wild West out there, so watch out. So what happened to Nurse Sarah is that she hung potassium without a pump. And guys, potassium is, if that thing opens wide open, it can kill the patient. Um, so that place was like short staffed. It didn't have a bunch of equipment. I think it had a sign on bonus, so watch out. Uh, because
Right.
they lack the nurses. Yeah. So then someone saw that, and then usually they'll just write you up and they'll be like, hey, we'll put you on a PIP, like a performance improvement plan. But again, they didn't like her, so they went straight to the BRN, reported her on her license. She had to hire a lawyer, took her about 2 years to get it expunged, and was on probation and probably about 15 to $20,000. So
Right.
don't do that. Watch
Oh,
out.
and don't drink and drive because even though you're not on
Mhm.
campus, even if you pull over and you're in your car and then they ask you, how did you get here? We're like, oh, I pulled over. No, no, don't answer those questions. But also, BRN,
Don't do anything.
BRN,
Uber it. Uber it.
they will put you
Mhm.
through the ringer if you drink and drive. They will
Mhm.
not let you go into leadership, and it may take years for them to get to you, and you'll have to do it. It's too long of a story for me to tell you, not for me, but from someone that I heard the story firsthand from. do not, if you're going to drink, do not drive. Regardless, do not. Just do not, or drive under the influence of any sort. Do not, because BRM will come after you. They're trying to make examples of nurses right now. Don't do it.
Yeah. That's what happened to my buddy. My buddy had 2 or 3 DUIs and was trying to get his nurse practitionership.
Oh,
Crazy. Took him a long time. And guys, it was like, I'm like, dude, you live in a small town. Even if you didn't live in a small town, let's say I live in LA or I grew up in LA, I would have paid $100, $200 to get an Uber, right?
Yeah.
right.
Because you know how much a DUI is, like 10 grand, and then you might not even become a nurse. It's not worth it.
Right.
Someone actually got a DUI on graduation from nursing school.
Yeah.
I'm like, dude, the worst time.
Celebrating a little too hard.
Yeah.
Dude, I know. Okay, well, we're about at time, but we have one more question from Zelka. Does Simple Nursing provide mentorship or mentoring guidance in terms of which degree path to go after with ADN in the new grad membership? So yes, we do the main ones. So we talk a little bit about nurse practitionership as well as CRNA, which is nurse anesthesiologist. Those are the big 2 guys. Everyone always wants to go into those 2 because they pay the most, and there's a lot of nurses that want to own Botox centers, so you need to be a nurse practitioner. In certain states, you can work autonomously outside of a provider. But CRNA is a really hot one. You get paid over 200 grand a year, and you sit in one chair and you do one thing. You don't have to do all these backbreaking things that nurses do. So I
Gotta
have
get
like,
into ICU though. You gotta have at least 3
yes.
years of ICU experience. It
Mhm.
doesn't matter. Not even, you can't even apply unless you have those 3 years. So is it 2 years or 3 years?
2,
2 years.
unless they
Okay.
bumped it up to 3 years. But
Yeah.
we include all those main ones as well as what it takes to become a DNP, a doctor and nurse practitioner. If you guys want to teach or go into research, we are putting together a career guidance or career pathways course. And we're going to be putting together transitions in practice to be able to transition to any other unit and have onboarding for that. So that's going to be great. Yeah. But cool, guys. Thanks so much for joining.
Thank you, everyone.
Yeah, yo. Thanks,
Oh,
guys.
wonderful. We love hearing that.
Yeah, yeah. Thanks,
Awesome.
Elka.
Thank you guys. Have a wonderful evening.
Appreciate you guys. Thanks.
Bye, you
All
guys.
right.